One.
Okay, are you on?
We're live on Facebook. We're
Live on Instagram.
And we're live everywhere.
Live everywhere.
We're live.
Doctor, welcome to Derm Bros Round 11. Cheers.
Cheers.
It's good that we got started. We finally did it. We made it to round 11.
It's amazing. Congratulations, Dr. Greenberg. Cheers to that.
Dr. Cotter, round 11. We decided that today was important that we talk about something that concerns a lot of people and we see every day in the clinic, and that would be STDs or sexually transmitted diseases.
I want to let everybody know that when we first put together this talk, it was about 3 hours long, 150 slides, and last night I edited it so it'd be PG-13. The length of the talk is going to be about 2 minutes. There's 10 slides, and there are no longer any penises, vaginas, or anuses, because this is going on Facebook and YouTube and Instagram. So it is PG-13, but parental caution advised.
For sure. All of the good slides, we still have plenty, but all of the ones that most of us wanted to see, they're going to have to wait for another moment, and maybe we'll put it on some adult section of YouTube at some point in the future. So, if you want to talk about, Dr. Cotter and I, for No Shave November, didn't shave, and we shaved in our mustache for today's talk specifically.
Yeah, so every year since medical school, I've done No Shave November, which helps raise awareness for cancer. Historically, it was prostate cancer, then testicular cancer, and everyone jumps on board because cancer is cancer and cancer is bad. We hate cancer, we want to fight cancer, and not shaving for a month, people always ask me, hey doc, you're always clean shaven, what's up with the beard? And I say it's for cancer awareness, you know. No Shave November, let's raise some money, let's donate it to cancer research. And every day at the end of No Shave November, I always shave something funny into my beard. And it usually lasts for about 2 minutes until I shave it off and go to bed before the next day of work. But this year, Dr. Greenberg decided, you know, we're talking about sexually transmitted disease. What's more iconic than the mustache? Let's shave in a mustache. And so, even though we're wearing our masks, except for when we're taking our drinks,
of course,
we do have our mustaches in solidarity for No Shave November and for, well, creepy guys with mustaches and STDs.
And if you must ask a question, you can either shave it for later or you can ask it while we're here. So with that, we have the slide, and it says...
Yeah, this is something that I used to joke around with folks, you know. What happens in Vegas...
doesn't always stay in Vegas.
And with that, we're going to be talking about sexually transmitted disease today.
So we don't want to make light of it. It's very common. We see it every day, and it just is something that happens. And most of these are treatable, but I think it's important that we all be aware of what's going on. It's just like with the current coronavirus situation that we have. You don't blame somebody for getting the disease, and if you get the disease, it's treated.
Yeah. I'd say for me in my clinic, the most common sexually transmitted diseases that I see would be first genital warts,
yep,
and then probably Molluscum contagiosum, which is super common in kids as just part of life. But in adults in the private area, it technically is a sexually transmitted disease. And then third probably would be herpes simplex virus, or HSV. And I see at least 2 or 3 cases of either genital warts or molluscum every single day in clinic.
Yep, me too. And this next person, I think this is an important slide because this is probably the most serious sexually transmitted disease that we see. It hasn't gone away. And when this gentleman walked in the clinic, he had these sort of red sores all over himself. And the minute I saw him, I knew what he had. This is Kaposi sarcoma. It is a condition that is an advanced form of AIDS.
Yeah, I think, Dr. Greenberg, you'd consider this an AIDS-defining illness. And
yes,
so when someone has HIV or human immunodeficiency virus, that is a virus that's attacking your white blood cells, the T cells that help you fight infections, help control cancers. And there's certain disease states that emerge when you have a dysfunctional immune system. And one of the more severe and concerning ones is Kaposi sarcoma. And they typically look like these violaceous or purple-hued, sometimes ruddy brown papules and plaques that show up on the skin. But they can also be inside of the body. They can be in the GI tract, in the mouth, they can be the lungs, and in those areas they can lead to life-threatening bleeding. And it's very concerning. I have great stories of when I was a consult resident at UC San Diego, and we would get called to see patients to rule out Kaposi sarcoma. And sometimes you can do a biopsy, but when the clinical diagnosis fits and a patient has AIDS, the treatment generally for Kaposi sarcoma is to treat the AIDS.
Yeah.
And so that's what we would recommend, is get patients on antiretroviral therapy and then follow up. And most of the patients did very well.
Yeah, and so this gentleman said, how could I have HIV? I don't have any risk factors. But if you're sexually active, that's a risk factor, especially if you're not using protection. And IV drug use, cocaine use, there are different, and cocaine specifically through a glass straw, but there are different ways that you can get this condition. It's very treatable now. It hadn't been in the past, but he wasn't even aware. So if you have an exposure, it's probably worth getting tested.
Yeah, I will say this was a life-changing diagnosis. I was here in the clinic the day it happened, and we had a medical student, actually, who was interested in dermatology. And Dr. Greenberg grabs us and says, hey guys, come check this out. And we walk in the room, very discreet. I leave with the medical student later, and he goes, oh my gosh, was that Kaposi sarcoma? And I said, yeah, actually it was. And just like Dr. Greenberg said, the patient didn't even know he had HIV. Yeah. And so you probably saved his life by making this diagnosis and getting him tested and getting him under treatment.
Yeah, and he allowed us, he said that we could use his pictures. I just blurred his eyes just out of his own privacy's sake.
So this is the public service announcement part of the talk. First, we awed you with funny jokes, and then we got your attention with the most serious of all of the STDs that we treat. But really, it does merit discussion that all STDs are on the rise in the United States. Syphilis is higher than it's ever been. Chlamydia, gonorrhea, through the roof. Multi-drug resistant gonorrhea. Lots of cases, and Clark County is no exception, and we'll come back to that a little bit later. So definitely be on the lookout.
I had so many good pictures of this next condition. We were at a conference together where somebody had it, and this is a condition where in between the fingers you get these scaling crusts. Usually on the creases of the wrist you get these pits. It's very itchy. And here we can see the mite and the eggs, and this is scabies.
So Doc, what makes scabies an STD?
Well, this is not an STD, but if it's in the groin area, then it can be an STD. It's transmitted. Sorry, Doc, that mustache is fantastic.
Oh, thank you.
It really makes me very happy.
Well, what I remember learning is that scabies has to be transmitted through close, intimate physical contact.
Correct.
And so what makes scabies, in some cases, a sexually transmitted disease is you have to have prolonged, intimate contact with someone in a skin-to-skin manner. So you see cases of scabies being transmitted amongst family members, children to adults and adults to children, because they spend a lot of time together. You also see it in nursing facilities where you have caregivers that are giving lots of attention and close physical contact transferring patients, and there'll be outbreaks, particularly of something like a crusted or a Norwegian scabies, which is highly infectious. And then what will happen is you'll have a family member will go and they'll visit a patient with scabies in the hospital, or, they'll visit their loved one in the nursing facility not knowing they have scabies, and they give grandma a hug goodbye, and they take scabies home to their babies.
Yep.
And we definitely see that a lot.
And here, scabies on the trunk, scabies on the scalp. And if you're debilitated and you can't move around a lot, then it can even get worse.
And in this picture here, it's hard probably to see on the live feed, but on the YouTube video later, you'll see it's really red, erythematous, and scaling papules and plaques, particularly around the belly button. But that can be a close mimicker for other diseases like psoriasis sometimes.
Sure. Yeah, it's a tricky one. So it's something to look out for. The really good photo I want to show is not available. And this was your case.
And yeah, this next case is another example of a mimicker. I think if you take a close look, again, on the live feed, you may not be able to see it, but this gentleman had multiple erythematous papules and small plaques on the trunk and extremities. Go ahead and go to the next slide, Dr. Greenberg. They were red, they were scaly, and I think there's a close-up on the next slide as well that maybe everyone can see a little bit better. It may be coming off with a glare. But I went ahead and I thought I knew what he had, and I said, let's go ahead and do a biopsy anyway. But then I looked everywhere on his body, including the bottoms of his feet. And the bottoms of the feet give away the diagnosis. They're these round, they're described as ham-colored macules or copper pennies. And it's a pathognomonic or textbook finding of secondary syphilis. And that's exactly what this gentleman had. And again, he was very gracious in letting us share his photos because it's important to educate people. A lot of folks think, well, is this rash psoriasis? Is it scabies? Is it from something I ate? But in the right context, you have to suspect syphilis and test for it and treat it. And these are just a couple of fun propaganda posters from World War II. Because men who know say no to prostitutes. And she may look clean, but pickups, good times, and prostitutes spread syphilis. And to be fair, we'll have some later that target the guys too. So
Yeah, I mean, it doesn't go one way.
yeah, exactly.
Yeah, and this was a gentleman in my clinic, and he had the chancre on his lip, and typically this is a painless chancre as opposed to herpes, which can be painful and multiple and clustered. This one is painless, and he also had it on his genitalia, which we're not going to show here. And this stain is for Treponema pallidum, which is the bug that causes syphilis.
Yeah, so when I make a diagnosis of syphilis, we have to do a couple things. And let's go ahead and hit the next slide. So we always have to report it to the health district. We have to do our best to contact trace, but once the health district gets involved, they help out with that. They make sure the patient is treated, usually with an IM penicillin shot or series of shots depending on the stage. We don't offer that shot in our clinic, but I always start every single patient that I suspect with syphilis on doxycycline.
Yep.
Because doxycycline is an alternative treatment for patients that might be penicillin allergic. And since I don't have the ability to give them that pen shot right in the office, I always start them on doxy just to be safe. And again, be careful where you party. And what happens in Vegas doesn't always stay in Vegas, because just recently, Clark County was still ranking first in syphilis rates. And ladies, keep in mind, syphilis, all of these men have it. So women, stay away from dance halls. It was true in WW2, and it's true today.
Well, the good news is we don't have to go to any dance halls now. Everything's closed. So what happens in Vegas stays in Vegas, except when it doesn't. This is folliculitis, and the reason that this is important is these are furuncles filled with pus, which is an infective, the reaction to the infection. And it can be transmitted by close contact. If you have open sores, you can transmit it to open sores.
And also, it's a good mimicker. I think a lot of people will come in, they'll have shaved their private areas, and they'll get ingrown hairs or folliculitis and be concerned, oh my gosh, do I have herpes?
Yeah, sure.
And you say, phew, no, you do not. You have folliculitis, you treat them with topical antibiotics, maybe oral antibiotics, and they do great, and they're very happy.
Which raises a good point. There's a proper way to shave, and a lot of times people will use their razor, not clean the razor. They'll use it maybe 100 times, and it's a dull razor, and then they get razor burn, and then they think that that's an STD, but it's not.
Yeah.
Going against the grain can be a problem. Going side to side. I'm always amazed at how people groom themselves.
How did you shave this in?
I went up and down. Actually, I just went down with the grain.
With the grain?
Yeah.
Because I know you like to go against the grain, but not when you shave.
I do, but correct. Correct. This next one is an abscess or a little pus ball, and when it was nicked and drained, there was a collection of greasy, cheesy contents that came out of it.
Yeah, looks like a ruptured cyst.
Correct. This is just a picture of Michael Phelps I found interesting. There's another condition called erythrasma, and there are these violaceous plaques. Typically, when you shine a Woods lamp on them, which is a special lamp that we use in the clinic, it has this birefringent color, apple green?
It's coral pink, actually. And so this is more of your clinical color, where you have your salmon brown plaques, but then you hit it with a UV light. And you know what? I should have thrown in my great case. I had a great case of erythrasma back when I was in San Diego with one of my friends, Dr. Keith Roby. And to this date, it's still the greatest case that either one of us has seen. I turned on the Woods lamp, the room was dark, and the entire room lit up glowing in a color almost the same as your pink scrubs.
That's nice.
It was pretty amazing. I think I have it in one of my Instagram stories from back in the day in the archives.
I like it. Yeah, benzoyl peroxide wash, clindamycin topical, or erythromycin topical. I can take care of that. This was a fantastic case. I'm not sure how the patient got it on his eyelid, but these are punched out ulcers on the eyelid, and this is herpes simplex virus.
Yeah, wow. Would you consider this a medical emergency?
Yeah, because you could go blind when herpes goes to the eye. So they will definitely need to see the ophthalmologist when it is in this location.
Yeah.
The herpes virus, although it looks like it's on the skin, and it is, rests in what, the dorsal root ganglion?
Yeah, it's in the nerve cells, which
Yeah.
is always an interesting conversation starter when a patient gets a herpes outbreak and it's on their bottom. But they say, but doc, I don't do anything down there. How did that happen? And then you have to explain the anatomy and the distribution of the pudendal nerve, which innervates the perineum, and how that herpes virus likes to live in the dorsal root ganglion, like you said, and then it'll reactivate anywhere within the distribution of that nerve.
When I was in medical school, they would say pudendal, it comes from the Latin for ashamed, but my professor said he never knew the Romans were ashamed of anything.
Ah, it's funny.
More commonly, the herpes simplex virus going to the lip, it comes and goes. It's a recurrent condition. And if somebody has this, and 70% of people are herpes type 1 positive and 30% of people are type 2 positive. So if you have it, you can take valacyclovir or acyclovir, and these drugs can give you like a 99% reduction in what's called asymptomatic viral shedding. And you, most likely when you're shedding the virus, you're doing so asymptomatically, and that's the most common way to spread it.
Yeah.
Even though this is going to be a highly infective
Well, I think
condition.
this is a good opportunity to talk a little bit about the difference between HSV1 and HSV2 and what does a positive test mean, because I spend probably hours every month cumulatively encountering patients that have lots and lots of questions of, doc, do I have genital herpes? And it's because at some point someone drew an STD test and they checked for something called an IgG or an immunoglobulin, which is a marker of past exposure, past infection. And so, you know, before, this is what I learned in medical school, HSV1 was above the belt and HSV2 was below the belt because you kiss before you do anything else. So 1 before 2. But the truth is, changing sexual practices over the last 10, 20, 30 years, and maybe longer, have altered that distribution. And so not every HSV1 and HSV2 is necessarily oral labial or genital herpes. And so we're seeing interesting patterns. So what I tell patients is if you've never had a sore in your privates, then you don't have genital herpes, no matter what your IgG says, because you have to have the primary infection to have the disease. And so you may just be as likely that you have an HSV2 oral labial cold sore,
Yeah, that's possible.
and that's giving you a positive IgG. And I think that, you know, is helpful information that reassures a lot of folks.
I don't know how you do it, but if anybody tests if anybody tests positive, I always have them take prophylaxis. Not prophylaxis.
Yeah, I recommend the daily antiviral as well.
And the reason is that if you spread it to your partner, whether it's a new partner, old partner, people aren't necessarily going to be happy that you spread it to them if you knew that you had the infection.
Exactly.
So the 99% reduction in asymptomatic viral shedding is a big deal.
I agree.
Yeah. Are there any questions about herpes virus? I think that all right. This next one's a mimicker. And you know, we saw the gumma on the chancre on the lip before we saw the herpes virus. And this is just a mucocele. So this is just a collection of clear contents under the skin.
How do you like to treat these, Dr. Greenberg?
Nick and drain.
Yeah, do you find that they come back or they stay gone?
Typically, I think they go away and they don't come back.
Yeah, I've just started referring everyone to oral surgery because I've done everything from nick and drain to intralesional Kenalog, and I've even excised them. And I just find they're very stubborn a lot of times. But if you're the expert in the clinic, I'll be sending them your way.
Oh no, I'm good. Thank you. I prefer to stay away, but I'll stay away from that. This one was fascinating. This is your case, and these are little punched outs.
So back to herpes. I mean, this was a gentleman with a rash on his hand, a painful, burning rash on his hand. And the close-up, you see these hemorrhagic and scalloped ulcers. They're not ulcerated yet because the skin on the hand is so thick that even though there should be an ulcer, the thick skin on the hand resulted in a blister, a deep blister instead of an ulcer. And they look like a cluster of grapes. And this is a textbook picture for herpes simplex virus. And the question was, well, doc, how did I get it on my hand? And sometimes we never know.
Fair.
But it is important to remember, especially if you have it on your hand, be careful what you touch because those herpetic ulcers are infectious. And just like our late Sean Connery in Diamonds Are Forever coined that term, diamonds are forever, well, herpes are too, so be careful. Again,
These are all treatable. So if you happen to get herpes virus, just know that it's treatable. And you know, don't lose hope, don't get depressed. We see people all the time. There's a psychological component to all these diseases. It's very real. So it's important to get help and deal with the psychology of what's going on.
Absolutely.
But you can still live a normal life and have this.
Absolutely.
I have a question.
Yeah.
The erythrasma
Oh, the erythrasma?
on the thighs, that is related to herpes?
No.
No.
No, erythrasma is caused by Corynebacterium minutissimum.
Yep.
I think they may have changed the name, but I'm
it's
pretty sure that one's still
Corynebacterium.
Corynebacterium.
Yep.
There's another Corynebacterium though that
Or there's another
causes
Klebsiella.
pitted keratolysis on the feet. That
Yeah.
was Corynebacter, but I think they changed that one to Chytococcus sedentarius, if I remember. But it's been a while since I took the board, so maybe not.
These are just, if you look at it under the microscope, these are what the ulcers look like, and there's some multinucleated giant cells underneath an ulceration. The skin is dead here. This is your epidermis, your dermis, and here's just the dead tissue with the multinucleated giant cells. It's a pretty cool picture. And this just talks about some of the ways to treat. Know that when we do some of the procedures we do in the clinic, like a laser resurfacing or filler in the lips, a lot of times, if we don't know the history, we'll prophylax with some medicine, including Cidovig, which is buccal acyclovir.
Huh.
It's a unique formulation. So there are options. And then he has a suspicious-looking mole on his shoulder. This is a mimicker. We did this before. So these are seborrheic keratosis, which are the brown waxy stuck-on spots, but these can also look like warts. And as we age, we get more and more of these. So when we see people in the clinic who have things like this and things like this on the genitals, a lot of times there's a concern. Is this bonoid papulosis? Is this seborrheic keratosis? Is this a wart? And it can be hard to tell. In this case, this was on the pubis, which is right above the pubic bone. And this was a benign verrucous keratosis. So this wasn't a wart, even though when I looked at it, I thought, oh, is it a wart? Is it a skin tag? And
yeah, and talking about wart mimickers in the privates, I've had a couple of patients in the last year or so that have come in with a diagnosis of genital warts, and they haven't responded to Aldera or Verigen or liquid nitrogen, kind of standard treatments. And it's actually because they didn't have that. There's a mimicker that we couldn't show called pearly penile papules, which are actually little fibrous tissue growths that pop up on the genitalia of men. It's a normal variant, uncommon, but a normal variant. And women have a similar variant, and it's called vestibular papillomatosis. So it's really important to be aware of these more uncommon diagnoses when you're evaluating a patient that has suspected genital warts, because if they've been there for a very long time and resistant to treatment, it may be that they're not a wart.
yeah, I mean, I've seen a lot down there that is...
Tell me more about that, Doc.
I gave a talk at one of our conferences that showed 10 different pictures of male genitalia and 10 different diseases that can go on in that area, including drug eruption, herpes, eczema, infection. I even had somebody who had, he said that he had a cyst, and I said, I'm sure it's not a cyst. It's not a cyst. It was a cyst.
Oh, there you go.
This is another mimicker in that area, but it's a pyogenic granuloma. So in that area, it could look like something else, maybe a wart, but pyogenic granulomas are just collections of blood.
Yeah, and another thing that we wanted to show but couldn't are harmless blood vessel growths that are very common on the scrotum and the vulva. And they're called angiokeratomas, and they can be a big problem sometimes. In and of themselves, just being there, no big deal. But if one gets nicked, they can bleed, and they can bleed a lot. So definitely they can be confused for more concerning things. But
yeah,
totally
and some
normal.
people cosmetically want to have them removed just because they don't like the look of that area.
Yeah. One of my past attendings from my UCSD days, Dr. Phil Cohen, has written numerous papers about male genitalia rejuvenation, actually, and he's talked about how you can use lasers to treat the angiokeratomas on the scrotum. Wow. Yeah.
All right, so this is molluscum, and this is the wart-like virus. It's a pox virus this was on the pubis. So, a sexually transmitted disease doesn't necessarily have to be on the genitalia, as you saw with the eye, the hand, and in this case, the pubic area itself, just from rubbing and contact.
And it's really important to distinguish that in children who have regular molluscum on their arms, on their trunk, sometimes on their face, their hands, that's not a sexually transmitted disease. That's just a normal part of child life. The molluscopox virus is very common. We're all exposed to it early in life. And just like any other cold, eventually your body develops immunity, and fights it off. But in this case, when an adult gets a recurrent molluscum eruption, especially in the privates, you have to think about sexually transmitted diseases.
These are warts. We did a talk on benign lesions when it was round 9, benign. And you can see there are these verrucous little papules. They can go deep. There's 100 types of wart virus. They look sometimes like little cauliflower. I've seen, just depending on, how many somebody has and the location, all the different types of warts, from this type to the deeper ones, usually in the genitalia. They look something like this.
Oh, you missed your last slide, I think. You got to go back one.
Oh, yeah, sorry. That one's particularly nasty. But they look something like that. Multiple ways to treat it. Cryotherapy, topical imiclomod, topical Verogen. These are the Verogen's a green tea extract. The imiclomod is a toll-like receptor 7 inhibitor.
Activator.
Toll-like
Activator.
receptor 7 activator, stimulates interferon and the body's own immune system. It is my favorite drug in the clinic.
It's kind of ironic, actually.
It is so ironic. Wrote a paper on that. We were doing that for Mohs surgery when I was in Temple, Texas, to shrink the size of the tumors before the Mohs. But that drug, that imiclomod drug, has multiple indications, including basal cell cancers, precancers, and genital warts. Any questions about genital warts? People are too ashamed to ask. Anyway, this is very 2020, the Crown Royal mask. It's interesting. I think that was our last slide, and it's kind of a shame because the really good slides, the 50 or 100 slides that we had of the genitalia were quite impressive.
Well, I think a couple take-home messages. 1, always practice safe sex. 2, if you do unfortunately contract a sexually transmitted disease, it's not the end of the world. There's great treatment options, and we're here to help. I probably see 10 to 15 new cases of sexually transmitted disease in my clinic every week. And so we have a lot of expertise in helping out in these areas. Patients do great, and we'll take great care of you. Yeah,
and I should point out that with HPV, with the warts, there is a vaccine, and that vaccine is called Gardasil. So, it is recommended for people, age 12 and above?
Up to 45 now.
Yeah, so I think it's a reasonable thing to do. If you're a sexually active person, you can prevent a disease. I know that the coronavirus vaccine is going to be coming out soon, and you can prevent coronavirus. So anything that there's a vaccine for is probably worth considering getting vaccinated against.
And
I agree.
Do you get the vaccine consistently or just one?
It's a series of 3 injections.
Yeah.
We used to offer it here in the clinic, but you can go to the health department.
Yeah.
They could do it cheaper than we could do it, so we now send people there.
Great. Well, cheers, Doc.
Cheers. Nice job.
See you next time.
All right.